Thank you all for coming. We're here tonight because Adagio has a program on the Better Health Outcomes series. This is the second part of the series that we've done this year. We did one earlier this year on opioid addiction. So tonight's program is on cancer and cancer care. And I have nothing else to say, so I'm going to turn it over to our CEO, VJ Lieber.
Thank you, Jim. So hello and welcome. I am VJ Lieber. I'm proud to be the president and CEO of Adagio Health. And of course, the first thing that we want to do is thank Dollar Bank. We want to thank Jim. I know there are a number of the folks from Dollar Bank here. So thank you for supporting our Better Health Outcomes Health Series, which is really our effort to make sure that we share information with the community that can help make us a healthy community, but also with the partnership we have throughout the year. And thank you for lending us Jim to be on our board. And thanks to all of you for being here. We know that we're all busy. There seems like there's a lot going on downtown. There's multiple events. I know all of you are busy, so it means a lot to us that you have chosen to be with us tonight. We also want to welcome the folks who can't be here, but the good news is, as you see, we are taping so that we will have people that will be able to watch online and social media and hear all of the good information that we have to offer for this evening. It's really important for us to have this opportunity to present these topics both to the folks who are here today, but also to talk to a larger audience about the issue of women's health and health equity. So for those of you who aren't familiar with Adagio Health, we're a nonprofit provider focused on women, but we do welcome anybody into our offices. We have 9 medical offices in Western Pennsylvania, pretty much surrounding outside of Allegheny County, but as far north as Erie. We focus on reproductive health, but in recent years, we have expanded our services so that it's more of a wellness safety net. We found that most of the women who come to us for reproductive health do not see another physician. So once we have them in the door, we try really hard to offer them as many services as we can to help them have a healthy life. We also focus on vulnerable populations, lower income, LGBTQ, women veterans. That's important to us, and we offer behavioral health, care navigation with vaccines and preventive medicine. So we really work hard to provide an array of services. We manage the WIC program in 5 counties, again, sort of surrounding Allegheny County. We provide tobacco cessation, which does include vaping. We were doing tobacco cessation before vaping was a thing. And I'm really glad that we had that in place and we had the momentum. We do a lot of work with high schoolers and try and have them convince their peers not to start vaping. Our nutrition education program goes into schools throughout Western Pennsylvania, but we also provide nutrition education to a lot of community groups. We just have opened 2 teaching kitchens where we're going to invite the community into our kitchens so that we can, as Brittany, who runs nutrition, always says, you might know that you should eat broccoli, but you're not really sure why or how to make it taste good. So we'll invite people into our teaching kitchens and help them figure all of that out. And we're going to have a couple of vans, WIC on wheels, so that we can reach more people. So the theme as I'm saying all this is we just are really aggressive about the services that we offer and making sure that we provide access. So I also want to thank our sponsors who made it possible to present our Better Health Outcomes speaker series and continue these conversations. First up is the Highmark Foundation, which is our preventing sponsor. See, I'm talking about prevention. Our presenting sponsor, and Kate Hancock is here. Let's give her a round of applause. In addition to being a supporter, Kate has joined our Young Leadership Council, so we're really glad to have her in the Adagio Health family. Additional support for our speaker series comes from PNC, Federal Home Loan Bank of Pittsburgh, UPMC Health Plan, Allegheny Health Network, and allies for health and well-being. And we always thank our board, our advisory council, and members of our Young Leadership Council. So we have two terrific speakers that you're going to hear from in a moment, but in the meantime, I'm going to introduce Alicia Schischler, who's our Chief of External Affairs, to talk specifically about our breast and cervical cancer screening program.
Thank you, BJ. So as we put together this speaker series, we wanted to make sure that folks understood our connection to some of these important topics as well. So I do want to tell you a little bit, that's fine, about our breast and cervical cancer screening efforts and the programs we have to offer. Since 1994, back when it was called the Healthy Woman Project, Adagio Health has worked with the state on a state-funded project to ensure that women who don't have insurance or who may be underinsured, which can mean really high copays for some screening services like mammograms, like biopsies, like ultrasounds, can obtain those life-saving and life-changing services. And you can see behind me, in the last year, nearly 5,000 clients screened for breast and cervical cancer as a result of that program. And we manage the program. You can see sort of the darker blue on the map. We manage the program in 62 counties across Pennsylvania. Almost 3,000 mammograms provided, over 1,600 Pap tests provided, and a lot of those clients were enrolled through Adagio Health medical offices. The others were enrolled through our partner medical offices. We work with folks, again, across the state. Tracy Frank is here. She manages that program. Hi, Tracy. and ensures that our partners understand how to enroll women, how they can find out more about the program and what we have to offer. Also, in addition to the BCEP program, that's the Breast and Cervical Cancer Early Detection Program, shortened to BCEP, we offer the Mammogram Voucher Program. So you can see there too, almost 900 clients who are able to take advantage of that. And that's folks who are income eligible. They will call Adagio Health and say, I need a mammogram, and we can make sure they get a voucher to get that mammogram at a number of different provider partners. Some of these numbers too, 32 clients screened for breast cancer. Our navigation program, we had over 200 clients navigated to take advantage of the BCEP program to make sure they could get the screening that they needed, and close to 400 applications submitted. We know that even the close to 5,000 women in the state who are able to take advantage of the screening programs. It's a great number, and we're really proud of that, but we know there are many more women who could use screening as well, who may not be aware. They may think they can't afford a mammogram, so it's really important for us to get the word out to let people know, yes, you can afford a mammogram. We will help you obtain those services. And some of the messaging we put out there to make sure folks understand that cancer screening is available at no cost. You can afford a mammogram. In the past year, we've worked on clinics where we're providing adult vaccines and also signing folks up for our BCEP program or for the Mammogram Voucher Program. And then BJ doesn't know that I threw this picture in here, but we were really privileged.
Yes, it's the same jacket.
So, well, it's her pink jacket, so that's fine. We were really privileged to attend the governor's signing of, I think it was Act 1 of 2023, and that was a first of its kind law in the nation that requires insurers to cover preventive breast and ovarian cancer screenings for high-risk women at no cost. That was a really big deal. Yay, yes. And we were thrilled to be part of that event and to attend back in May of this year. So I'm going to turn things back over to BJ. We have some really wonderful speakers. We're so glad that you all took the time to join us tonight and to be part of this effort.
I will add that, and I'm sure everybody in this room knows it because you have an interest in women's health, but Governor Shapiro has already done a lot to support women's health care, to support health equity, to support access to health care, and has pledged to continue doing that throughout his term. I always say that most of us are probably not lucky enough to get thank you notes at work from people who say, thank you, you saved my life. And that sounds dramatic, but we really do get those notes. And when we were preparing for this evening, I asked the team if they could give me an example of a thank you note that we've gotten recently. And I just want to read this to you. This is from a woman who had insurance, but she didn't have good coverage. And so there were some challenges in terms of getting screened. And she says, "I'm writing to thank you for your help and patience during a difficult time. After many phone calls, I was able to receive assistance from Adagio Health for much needed procedures. The assistance I received was a blessing and is so gratefully appreciated. Thank you for your patience and thank you for helping me." And that really sums it up. We are really honored to be able to help these women. And I will tell you that more times than not, when I get those thank you letters, there's a $10 or a $20 bill in the note. And they'll say, "I know this might not go far, but I'd like to pay it forward and help somebody else." So that's one of the many reasons we're honored to do the work that we do. So our first speaker tonight is Dr. Christy Hilton. Dr. Hilton is a medical oncologist specializing in the treatment of breast cancer at the Allegheny Health Network Cancer Institute at Allegheny General Hospital.
So thank you so much for having me. So I am the medical oncologist, so I am the chemotherapy doctor, okay? And you know, thinking about what I wanted to talk about tonight, this was on the flyer for the invitation. And I think it's very telling. It says, you know, here in the United States, Black women are 40% more likely to die of breast cancer than white women. And for women of all ethnicities, all of these social reasons, lack of education, poverty, neighborhood disadvantage, lack of social support, play an important role in both breast cancer diagnosis and survival. And so how can we make a positive change and turn that statistic around? And so I'm glad that you had talked about mammograms and screening. I hope not because my slides didn't have any of that in it. Because that is certainly important, right? Preventing a breast cancer from happening is super important, and having these free mammogram voucher programs is super important. But I really wanted to talk about another really important thing in breast cancer care once the breast cancer is already diagnosed. And, you know, and that would be clinical trial enrollment. Okay, so here you can see female breast cancer is the most common cancer. You can see there estimated new cancers in 2023, over 297,000. Estimated deaths in 2023, 43,000. So when you look at the other types of cancer, you'll notice that the deaths are not equal to the incidence. And so that's good. That means that we have good treatments for breast cancer, right? But we can always do better, and it can get better. Here I want you to look at the different breast cancer subtypes. The vast majority of breast cancers are ER/PR positive and HER2 negative, meaning driven by hormones, okay? But I want to really focus on the triple negative, which are the two with the star. So it makes up about 10 to 15% of all breast cancers, the triple negative. And if you look at the 5-year relative survival rate over here, you can see that it's the one that has the lowest 5-year survival rate. So it's the most aggressive. And it's triple negative because it means that you check all breast cancers for 3 things: estrogen receptor, progesterone receptor, and HER2. The estrogen and progesterone receptor are the female hormones, okay? And so that's negative. So that cancer doesn't thrive and grow in the presence of estrogen. And also the HER2 is negative. So there's no targeted therapy for that cancer. So by and large, before really 2021, most of the treatment is just chemotherapy, okay? So most aggressive cancer makes up about 10%. And when you look here at the different types of relative survival rates, you can see here localized. When you find cancers early with the mammogram programs, finding as early as possible, you have the best survival. Because you can see here, localized breast cancer across all subtypes is going to be in the high 90%. Okay? Once it goes to regional disease, meaning to the lymph nodes, then it starts to drop down a little bit. But once it's metastatic, meaning not just the breast and not just the lymph nodes, but going to some other organ, skin or bone or liver or lung, then the survival rate at 5 years drops down significantly, and it drops down the most for your triple negative breast cancer, okay? So why is that important for looking at quality of care and access to care? It's important because when you look at the rate of female breast cancer broken up by looking here at non-Hispanic white women versus non-Hispanic black women, you'll see the difference is in this area. And that's the diagnosis of triple negative breast cancer. So triple negative breast cancer is the most aggressive, okay? It's most likely to be found more advanced, and it's higher incidence in non-Hispanic black women in comparison to non-Hispanic white women and Asian women. And when you look here at the rate of new cases by race and ethnicity versus the death rate with race and ethnicity, you'll find that non-Hispanic black women and non-Hispanic white women, the incidence is about the same, 128 and 136 per 100,000 cases. But when you look here at the death rate, it's much higher for non-Hispanic black women than it is for white women. And that reason is multifactorial, right? There's no one reason for it. But it's important that we address that and try to figure out how we can make that different, how we can make that better. So looking just at triple negative breast cancer, we know that it has a higher risk of distant recurrence, higher rates of visceral and central nervous metastasis, so mets that go to the liver, the lungs, and the brain, earlier time to recurrence, and a worse prognosis when it becomes metastatic. A lot of that has changed. We've got a lot of great treatments for it, but in general, that's what triple negative breast cancer is. And so I wanted to touch briefly about a molecule and dive into a little bit into clinical trials, okay? Just a little bit. And if it becomes something where you guys hate it, just say, move it along, Hilton, and I will move it along, okay? But this drug, sacituzumab govitecan, which most people just call SASI, SASI came along and it was a game changer for metastatic triple negative breast cancer, okay? So in April 2020, the FDA granted accelerated approval for SASI in patients who had metastatic triple negative breast cancer who had received at least 2 prior therapies for metastatic disease. And we had this trial at AGH, and I had women on this, and it really was a game changer. Does it have side effects? Sure. But these women, I had women who had 4 lines of therapy. They were very sick, and they got this drug and stayed on it for over a year. That's amazing. That's great for metastatic disease, right? So in the phase 1 trials, it showed that women really did well. They had great response rates. 1/3 of them responded. Other patients had stable disease, which is a win in metastatic disease also. And so that ended up going on to the phase 3 study. So just a little bit about why this molecule is exciting. And you don't have to look at the slide if you hate it. But this molecule actually binds to a receptor that's highly expressed on triple negative breast cancer, but they found now that it's also expressed on those hormone-driven cancers. And this molecule binds to something called TROP2 that's expressed on the surface of the cancer cell. And then it sucks the chemotherapy into the inside of the cell. Once the molecule's inside of the cell, it breaks off the chemotherapy and then kills the cell from the inside out. And then it leaks around and kills the cells around it. So for tumor biology of killing, it's amazing, very exciting, okay? And the little red dots are the chemotherapy there. They are in such a potent high dose that if you gave them to a patient, it would be very toxic. So the fact that you're able to design these molecules where it binds to the cancer cell, goes inside, and then releases the chemo, allows you to give such a big dose of that chemo, which would otherwise be very toxic. So the designer drugs that the drug companies come up with are very exciting. Okay, so this was the trial that was in the phase 3 trial that we had. And what you saw is that they showed the 69 patients with metastatic breast cancer, triple negative. The response rate was 30%, partial response is 19, and complete response is 2. So even though that's a low number, complete response means on the imaging they don't see any cancer at all. That's NED, no evidence of disease, which is amazing, right? So because of this early study, they went on to the second study. And nothing is without complication, right? So there are some side effects, but they are very manageable. So the phase 3 study happened, and it confirmed the same thing as what they found in the early studies. So this looks at, when you look at a curve like this, the blue line are the patients in time on the sacituzumab, and this gray line are the patients that got treatment of physician's choice. So whatever chemotherapy they thought the patient would do well with. And when you have the curves separate and the treatment arm is higher, that means that these patients lived longer, did much better, and didn't have progression. And then when you look at this curve, it's the same kind of thing that you're looking at, but looking at overall survival. How long did these women live? And when you think about heavily pre-treated women, the women who got the treatment of physician's choice, what their doctor thought that they would respond to, it was 5.7 months versus 12.1 months. And that is a big difference because you can do a lot in a year. Is it long enough? No, it's not. But it's a lot better. It's double the time. And when you think about if time is limited, if you have double the time, what does that mean to you? It means a lot, right? Absolutely. So the reason why I'm bringing this up in this talk is because looking at who was in this study, you'll see that white women made up the most percentage. 80% of people in this study were white women, right? 12% of patients in both arms were black women, and 4% were Asian. 4% didn't identify as any heritage. So why is that telling? It's telling because I just told you that triple negative breast cancer is more prevalent in black women. Yet we only have 12% in this trial, and that's a problem, right? It's a problem. So looking at this type of a plot, when you look at scientific things, I'm looking here at the different race, white, black, and Asian. So white, black, and Asian. And when you look at a plot like this, anything that falls to this side of the dotted line means that the SASE was better. Anything that falls to this line means physicians of the chemo that the physician chose was better. So you can see that all groups did better with the sacituzumab, okay? But it's important to know, did it actually work with that only 12% with black women? And so this is an abstract that was done that looked at those 12% of black women to see, did this drug perform just as well for them as it did for the 80% of people that were in there? And it did. So of those 62 patients out of the 529 who received the sacituzumab, the median duration of treatment was 5.3 months for the sacituzumab versus only 1.6 months for the chemo that their physician thought would work best. So that's huge, and that's the same as what it was when you look at the population as a whole. And the median overall survival was longer with the SASE, 13.8 months versus 8.5 months. So what they found was in that 12%, it worked just as well as it did for the whole population. So that's a good thing. But is that always true? We don't know, right? So this study came out with a subpopulation of that 12%, but not every study has that. And if you look at studies, black women usually make up less than 3%. So this was a triple negative metastatic trial for triple negative, and it had 12%. You might say, oh, that's good, but it's not good enough. It's better than 3%, sure, but it's not good enough. And I think what's exciting is that, when you look at the population as a whole in the United States, black patients make up 13.4% of the population. They're saying here 5% of clinical trials overall for all diseases. But in breast cancer, it's 3%, okay? Hispanic patients, 18.5% of the population, only 1% of trial participation. And non-Hispanic white patients make up 60% of the population, but over 77% of the clinical trials. So why is that, and how can we make that change? Because it's not reflective of the population that these drugs are designed for. So what can we do to help boost diversity in clinical trial participation? And this is a huge push. And what's nice is that the FDA has given guidance in 2021 for the first time. So I think now in 2023 and going forward, we're probably going to see the fruits of that labor. And what they're telling people now is when drug companies are submitting for a new drug to go into clinical trial, they're asking that those companies have plans with how they're going to recruit patients from underserved populations so that the drug is tested and better reflective of the entire population so that we know, is it really working in everybody? And they have different ways of, no one knows how to do this, right? This is all brand new, but there's a lot of people trying different things, and I think it is an exciting time to be in clinical trials, okay? This is a part of the principles that the FDA put out to pharma, and pharma has accepted. The principles focus on four main areas. So building trust and acknowledging the historic mistrust of clinical trials in the Black population. That's important, right? We all know about Tuskegee. Everybody knows about that and those atrocities. So discussing that there are laws and rules in place so that that can't happen, but it did happen, so that mistrust is valid. So trying to build trust to overcome that. Reducing barriers to clinical trial access. So sometimes you need to be able to go into a center which might be far away from home. And so drug companies are now trying to find out how they can open trials in centers that might be serving a more diverse population so that you can bring those trials to those communities and having more resources in those communities, which I think is amazing. And hopefully they will do a really good job with that. Using real-world data to enhance information on diverse populations beyond product approval. So going and having all of these studies where they do surveys afterward for symptoms, patient-reported outcomes. So during your treatment, doing surveys so that you can tell people how you felt during it, what your symptoms were. That's not necessarily on a trial, but more on a registry, so that people can understand and you can collect more data that way. And then enhancing information about diversity and inclusion in clinical trial participation. So letting people know that clinical trials are good and going out into communities and hoping that people can say, like, you should consider a clinical trial. Because these drugs, the women who were on SASE during that trial got to live longer. You never know what the outcome of the trial is going to be, right? But at least informing women that you should actively look for a clinical trial. This could really not only benefit you, but benefit every woman that gets diagnosed with this afterwards. And so that is my hope from this talk, is that everyone leaves here thinking, okay, clinical trials are a good idea, and that is something that we should be telling other people about so that they can spread the word that these are important things, and it's important that it is allowed to spread and give an opportunity to participate in everyone that reflects our population. So something that I think is really wonderful that I share with my patients is, I don't know if has anyone in the room heard of Ricky Fairley? Anyone? No? Well, you should look this up. So the Black Breast Cancer Alliance, this is her website. She's an advocate, and she works with drug companies, and she really, she has patient resource information on her website that you can give to patients that discuss about clinical trials from her perspective, written in language that makes a whole lot of sense. Easy to read pamphlets, things that can resonate with people. She does a lot of speaking and is really pretty remarkable. She has different kind of podcasts where she brings doctors in to talk about things that are important to patients, where the slides aren't like mine, but a little bit better, and talking about things that are important to patients. So I think that this is an excellent group. She also has a lot of links to Black Breast Cancer Matters, talking about, they have students that they recruit to go out into the community and talk to different communities about clinical trials and why it's important for participation. And then also when we trial, is a part of one of her initiatives to get more people involved. So that is it. Are there any questions or anything like that? Okay, great. So mine is over, and your next speaker is going to be introduced, and I can't wait to hear it.
Thank you so much. That was terrific. I was sitting there thinking, when we talk about health equity and access issues, we're talking about frontline. We're talking about some of the more traditional barriers, transportation, income, those kind of things. But we also have barriers around trust and barriers around access geographically. But I had never really thought of it in relation to trials, the whole way back to when medicines have to be developed that will be effective for all of us. That was great. Thank you. Thank you very much. Our next speaker is a breast cancer survivor who also wears many other hats: mother, coach, entrepreneur, and leader. And as I was reading this afternoon, I was thinking I really need to thank Felicia for making me feel like a real slacker as I introduced her. She was a recipient of the Be the Change Award. It's Felicia Mysick by the Pennsylvania Governor's Conference for Women. She has been honored as a Beaver County Star, recognized as a coach at the Black History Achievement Awards Banquet, and selected as one of 40 under 40 Rotary Legacy Zone Young Professionals. She has also received the Heart of a Lion Award from the Lions Club International for her commitment to community service. She founded Ambridge Connection, a community development collective promoting civic engagement and investment in her local community. And if that weren't enough, she played semi-professional football in the National Women's Football Association as a starting cornerback, which is very cool, and has coached competition cheerleading, varsity track, various football camps, as well as high school and youth football teams. She's currently the head coach of track and field and high school girls flag football for the Ambridge School District, and in her spare time serves on a number of committees and boards throughout the region. So we are thrilled to have you with us tonight.
I'm Felicia Mysick, and I'm a breast cancer survivor. I'm reading it, so give me a second. A leadership development coach and a speaker, and I'm a co-founder of Ambridge Connection. But none of those titles really mean anything to me. What I am is a person. And what you'll see in these pictures is I'm a mother of 4 kids, but you'll see just my husband and our 2 kids that are still at home. My guy football team and my all-girls flag football team, which is pretty cool because we're at Acrisure Stadium and the Pittsburgh Steelers is supporting high school girls flag football. We're an emerging sport in the area, so this is really, really exciting times for women right now. But I wanted to tell you guys that I'm a person because when, just like you just mentioned, that very first line, that Black women are 40% more likely to die from breast cancer, that's what I got. When I was diagnosed with cancer, I go into my office, and guess what I see? This magazine cover just sitting right there. Cancer has a color, or cancer sees a color. You want to not Google, but guess what? I had cancer. I'm going to Google something. I'm going to ask somebody. I want to know, what am I up against? And I was told, bold letters, bold everything, you're going to die, you're going to die, you're going to die. You're Black, you're going to die. That's what it sounded like. That's what it felt like. I walked in my office, I'm like, someone talk to me. Help me. I'm only 1 year from surviving cancer. So please forgive me if I get a little emotional. Plus, on top of that, they give you these shots. So I am like my life before cancer was fabulous. I loved it. I did what I wanted to do when I wanted to do it. But cancer told me to slow down. So I kept telling myself, God's giving me a new assignment. I'm supposed to learn something through this. I did. I learned depression. I learned anxiety, frustration. It took me all over the place. And I hated that because I kept telling myself, I live in Pittsburgh. You know how many medical offices that are here? You know how many doctor's offices here? UPMC, AGH, right? Did I say that right? You know, there are doctor's offices everywhere. Why am I the first to die? Why is my life expectancy going to be lower than the white women? Why? So I started looking and started digging even more. I'm like, you know what this is? It's because I didn't get the knowledge. I didn't have transportation or the mannerism of the doctors and the nurses and how they talk to me in the office. How horrible is that my life will be shortened because someone doesn't take time to just talk to me like a human. Someone doesn't take time to say, how's your day going today? They just come in, okay, I see the paperwork, okay, it's good, let's go. Just talk to me. I had an experience. I was in my appointment, and I learned that I had to go and get my lift notes. They were checking my lift notes and stuff to make sure I didn't have it in my lift notes, right? But it wasn't clinical or factual. One of those means that they didn't really go in and do it. Can you help me out? Is it factual when they? Clinical.
You didn't have a biopsy, so
Yes.
clinical.
So clinically, clinical. Yeah, we're gonna go with that. She's a doctor. I'm just a person. But I found out that I didn't have it in my lift notes, which was great. That was a Friday. It was all good. Then I went home, and then all of a sudden, I had a question I needed to send my doctor, which is great because now you have an app and you can go ahead and send messages to your doctors anytime you're thinking of it. I was like, oh, I'm thinking of something. And I sent the message through. I get a message back. Well, it's in your lift notes, so we're going to have to just talk about this on Monday. Wait a second. I was just in the office, and they told me it was not. So now my mind is going crazy. It's in my lift notes. My 5-year expectation has gone down. I'm in a parking lot at the hair shop, mind you, because I was going to look fabulous. My goal was to get as many wigs as long as I can because I wanted to look good. But I couldn't get out of the parking lot. I couldn't get out of the car because the message came in, because just as easy as it is for me to send off a note, it was just as easy as them to send me one. So I'm sitting in my car and I'm listening, I'm reading this, and I can't go in and go buy a new wig. I can't get up, I can't move. I'm paralyzed because somebody didn't take time to care about me, which is why I said no titles matter. I am a human. I am a person. And I'm hormonal. And I'm telling you guys this, if you do anything, treat everybody like they're people. End of the day, if you don't have time, take a second out and say, hey, I'll get back to you later. Shoot off a quick message, but don't answer them quickly because you can ruin so much. So the amount of stress that I had just shot up 10 times higher. All I wanted to do was get a 26-inch wig so I can swing it across my butt. That's all I wanted, but I couldn't do that because I was in my car paralyzed. Because black women, that doesn't even sound right, black women don't get the care that they deserve in the office. It's simple. How is your day going? What's going on with you? How are your kids? How easy is that to do to make a person to feel connected? I'm not a car. I'm not, I kept thinking like he was like a used car salesman. That's what I kept thinking, like the way, come on, let's go, blah, blah, blah. It was quick, get out. I didn't want that. So, long story short, I made a complaint in writing, in person, on the phone, everywhere. I wanted the best care because I had people that rely on me. I have my children and my husband that rely on me. Outside of that, I've been coaching for years. All these women now are coaching tackle football. I've been doing it for 20 years. I was the first female to coach tackle football up in Moon, first female to coach tackle football in Ambridge. I've been on TV shows, reality shows coaching tackle football. This is what I do. So I have youth that are looking to me for guidance, for moral support. I didn't want to leave yet. I wasn't ready. They try to say it's glamorous, but I did have a fabulous picture of me. So I could have went bald, ladies and gentlemen. But I want people to see this because you always see the pictures of people when they don't have the hair. You always see them when they look good. But this is what it really looks like. That's who I was. That's what I became. I'm a human who was just going through some stuff and I needed someone to care about me. I always wore a watch because I wanted to see how long I was sleeping. But occasionally I would get up and just try to just move. And the best moment of my day was around 11:30. I was able to get up, I made it downstairs to my kitchen and back up to my bed. And then I was done for the rest of the day. Cancer destroys you. You see the pictures online with some people who sit there and talk, but you don't realize really what happens, that you're done. You know, I used to, and I'm a project management type person with my life and everything. So I sit down and I schedule everything out. I like to plan. So I have my own little decide method that I coach other people to do. And I started thinking about myself okay, how do I do this? And I sat down, I learned chemo's gonna hit me, I'm gonna have 10 days out, then my immune system's gonna be this low, and this is the days out, 4 days I'll be able to be in public. And that was those 4 days, my goal was to do everything I could in those 4 days. Because this is what the majority of my days were. My best moment was just a break, just a glimpse. So after so many rounds of chemo, the horrible stuff, there's some chemo that I got through that was okay, but then there was some that really kicks you in your butt that you don't think you're going to live. I got to a point that I had so much ringing in my ear that I couldn't communicate. I couldn't talk right, so I started just doodling. And now I look back at the doodles and I'm sitting there wow. But it would be quiet out of nowhere, and then out of nowhere, I would get a new side effect. I can't taste. My fingernails are all black. Something's going on with me. Here's a couple of other doodles. This one right here, like I said, it was this. Someone would talk to me. Because mind you, if you have your wig and stuff on, no one really knows what's going on. But they don't know that I can't hear you. I am fighting through the sound to be able to hear someone. This is a point when I really didn't think I could go and do anything. I said, I'm scared. I don't want to go. I know I just need to pray. But I became one with my bed. It was very difficult. But one day, I don't know what made me draw this, but I was saying life and death. White women, black women, ads, studies, and articles. That's what the internet tells you. Life and death. I couldn't hear it. I couldn't get past it. I wanted to live. But I'm sitting here, I started digging deeper, and then I found a study online, and I'm going to have to share that link with you guys. But literally someone thought the same thing, the same way I thought. And they went through and they found out literally it's just simple things, just having access to information. Having access to education. Having someone just talk to you and to say, hey, did you know that you can get a free mammogram? Did you know that these people provide these things for you? Don't skip it. Take care of yourself. But I'm cancer free. I did get a little emotional with you guys, but I wanted to just share with you that I love what you're doing. I love that the clinical trials, and yeah, there's a lot of black people who will be like, no, we know what you're doing. Because that's the way that the mindset is. That's how we've been conditioned to believe, because it's been, if something happens over and over and over again, what are you going to do? You're going to back off and be like, no, you ain't trying that on me. Go try it on any of those white women first. and then come back to me. It is very hard because you have to build that trust. But what I love about WIC is everybody knows WIC. Everybody knows Adagio. If you're looking for the low income, those people, they know that. Go out, continue to share, and bring us in. Bring Black people in there, bring the Latinos in, bring the Hispanics in. There, it's there. You have a trusted community already. People trust WIC. Please continue doing it. And last thing before I go, I didn't know this was happening before I did this. I teamed up with Adagio at the Beaver Valley Mall. And they said they were going to help me celebrate life. I am not a person who knows how to sit and just take things. I've been built, just like most Black women, resilient. We've been built from think of Lego blocks. Nope, resiliency. That's all we got. And I don't want to be it. I want to be soft and feminine, have that energy come out, at the same time I coach football. So, okay. But the point is the only way I got through all of this is the fact that I kept telling myself I had a goal. My win, I was going to have wins for my day. Every single day I was going to have a win. And now that I survived, my goal is to help other people have wins too. So this Saturday, up at the Beaver Valley Mall, we are having a Women's Health Day celebration. And not everybody knows this, but it's the fact that it's my 1 year anniversary. We're going to celebrate. What I'm going to have is live entertainment. I'm going to have all of the Adagio team is going to be there, from tobacco to cancer screening to WIC, the whole nine. They're all going to be there. I've invited people to come down and speak on how your hormones are affected, if your house is affecting your hormones, to financial literacy and stuff. So it is just a day of fun. Also, there's another room I'm going to have that's going to be movement. My whole thing, it's all about eating healthy, thinking healthy, and moving healthy. And I think if you do all those things, you're living in the moment. And that's the only thing I survived, because every time I thought of the future, I got, anxiety. I thought of the past, I got depressed, because I was like, I'm planning too much, I'm not being here. And now, I'm wanting everybody to say, hey, let's go shopping, let's have some fun, let's listen to some music, let's do some self-defense classes, let's go take that class on hormones. I want to have fun. So, thank you guys for this opportunity.
Wow, I was sitting there listening to Felicia, thinking that we use the phrase health equity a lot. We talk about health equity, we're committed to health equity, but sometimes you have to stop and think what that really means. And you are an inspiration. You personify the reason that Dr. Hilton and all of us at Adagio Health do what we do. You're an inspiration, and we're really glad you're here. Thank you. So thank you, everybody. Thank you again to Jim and the Dollar Bank team. This was just a lovely night in a lovely location in a lovely city. It's really nice to be together. If anybody has any ideas for future speakers, we are planning to continue this in 2024, and there'll be more information coming out soon, but please let us know your thoughts. And again, thank you to Kate and everybody who has supported us as we continue our journey to use the work of people like Dr. Hilton to help people like Felicia. So thank you.